Hi, this is George Alger, and welcome to today's segment of Our Ventura TV. Today's topic has to do with heart attacks and stroke. And our guest experts today are Andrea Ricketts and Evelyn Scott. Welcome, ladies.
Thank you for having us.
Yeah, thank you.
Andrea, let's start with you. What is your role?
Well, my role is primarily, I'm a cardiovascular nurse practitioner, and I manage the Health Aware program that focuses on cardiovascular disease in the community, on education and prevention.
Okay, so in the context of this conversation, cardiovascular is also going to be focused on heart attacks, correct?
Yes, that's correct.
Good.
Heart attacks.
And Evelyn?
I am a registered nurse with the Health Aware program, and today I'm going to be focusing on education and prevention in regards to stroke.
Cool. So first of all, let's help our audience understand the difference by defining what each one is. So, Andrea, let's start with you. What is a heart attack?
A heart attack is basically partial occlusion or full occlusion of an artery that lays on top of the heart that prevents blood flow from reaching to the heart muscle.
Okay, cool. And Evelyn?
A stroke is a disruption in circulation to the brain. So there's two different types of strokes. You can have an ischemic stroke, which occurs when you have a blood clot or a plaque formation that dislodges and causes that disruption. Or you can have a hemorrhagic stroke, which people commonly refer to as aneurysms. However, they're both a disruption in the blood flow to the brain.
Okay. So let's talk a little bit more about a heart attack first. And basically, based on what you were just saying, I think this would be a great time to bring out this little illustration of how the blood flow can get constricted. So, Andrea, can you explain this?
Correct. People that have clean arteries that are size of spaghetti that lay on top of the heart, this is a complete blood flow going fully all the way through, and this one on the other side is probably about 90% occluded, where the yellow presents the cholesterol, plaque formation, and the blood flow is the red as it's going through. You can definitely see how the blood clots there, and it has partial occlusion to maybe some other partial occlusions here, causing a heart attack or symptoms of a heart attack, chest pain.
Okay. So, in this case, the blood is just simply not getting to the heart.
Correct.
Okay. Whereas with a stroke, it's fully, do I get that right? That instead of it just being completely constricted or greatly constricted, with a stroke it's actually stopped, or stopped at least at the brain.
Yeah, the blood flow to the brain. So if you were using this example with this artery here, if a piece of that plaque that you see there in the yellow broke off, floated upstream, that would cause the stroke. Or if there was a blood clot that was stuck somewhere in there and then became dislodged, that would cause a stroke.
Okay.
But they're causing all neurological symptoms with the stroke.
Okay. And I think you're referring to this yellow stuff as plaque?
Plaque, uh-huh.
Okay, good. Now, how does cholesterol fit into this picture?
Well, the cholesterol is a blood product, and there's good and bad cholesterol, and many patients are on the cholesterol medication that is trying to reduce the production of the bad cholesterol. We also have good cholesterol that takes our neurotransmitters and hormones and whatnot all throughout our body, and the good cholesterol takes a bad cholesterol out through the liver. But over time, according to your lifestyle and eating habits, physical activity, the bad cholesterol builds up, and as it thickens and builds up, it then reduces the blood flow going through.
Okay, so I'm still trying to grasp the difference between cholesterol and plaque, all right? So plaque is what's constricting the arteries, but cholesterol is helping to control the plaque?
Cholesterol's in the foam cells.
Right.
Plaque is what's formed, and it's stuck there. That's what's formed in the artery. It's stuck there. We can't change it. We can't do anything about it. So by keeping your cholesterol levels low, that is preventing the formation of plaque. Does that make sense? So once your artery looks like this, there's nothing we can do other than surgical intervention if we needed to.
Oh, so this is really an example of an extreme case.
Correct.
Okay, cool. Now, we have another one here, and I guess this is a cross section.
Yes, this is a cross-section of an artery. Like I said before, it's the size of a spaghetti. This is not the actual size of the arteries that lay on the heart. So here in the yellow here, I know it's kind of vague here, but the yellow part is indeed part of the plaque forming, because the cholesterol with the blood is going through and it's seeping through the inner lining of the artery and it's going to the second, creating the plaque formation inside the second lining. So the cholesterol is in the bloodstream, the bad cholesterol seeps through the inner lining and goes through the second lining and creates plaque.
Okay, and then these are pretty congested.
Yeah, this is the calcified area, and this is more stable plaque formation because it's calcification. This is the unstable, where the younger people have heart attacks because it's unstable and it ruptures, causing a clot. Yes, so indeed they do have a heart attack because it's completely blocked from the clot. Where down here, this is stable plaque formation, and this is about 80% occluded, where people will have chest pain, shortness of breath, and other symptoms of a heart attack if indeed they were doing some kind of exercise. Yeah, about 70% of the people that are about 70% occluded will have it at exercise, but the average couch potato will not have symptoms unless they're about 90%.
Wow, okay. So this is a lot of stuff that could potentially cause a stroke as well, because they've got a bunch of junk in there.
Yeah.
So what is more common, stroke or heart attack?
The heart attack is the leading cause of death. 65% of women have heart attacks, and the men, it's not also number one for men having heart attacks as well.
Okay. And then how do strokes fit in terms of, is it like second or third, or I mean, just as a point of comparison?
I think right now it's the fourth leading cause of death.
Really?
Mm-hmm.
Okay, so from the point of view of someone who's watching this, their higher concern is a heart attack, and in terms of their blood anyway. Higher concern is heart attack, and the next one would be stroke. Okay, good. Now, in terms of prevention, are there similar points that people should be aware of to prevent heart attack and stroke?
Yeah, healthy lifestyle is the main one. Obesity is a major risk factor in both heart attack and stroke. So just getting that exercise in, low-calorie diets, low-fat diets is one of the major preventions. Another one that plays a role in both heart attack and stroke is blood pressure. So addressing the blood pressure issues, which again can be helped with diet and exercise. So
good,
I would
basic
say those
stuff.
are the two, yeah, and that'll decrease the cholesterol as well. So that exercise, healthy lifestyle will decrease your cholesterol, decrease your risks, prevent blood pressure issues.
And for some folks who might be a little averse to the concept of exercise, I mean, does exercise even include something as basic as just walking?
Yes, the American Heart recommends at least 60 minutes, 5 days a week, but even if you have to do 10 minutes in increments of 5 times a day, or just even 10 minutes to get the blood flowing from your legs to prevent any clots from forming, 10 minutes would be fine. 5 minutes out, 5 minutes back, just walking and moving around.
Good. Okay, and I know that we have this poster here. So, Evelyn, could you tell me what we're looking at?
Yeah, that's in reference to stroke. So if you or anybody you know seems to think they're having a stroke, this is one way you can figure out and kind of decipher through that, as well as knowing what to do with it. So the acronym is FAST. So if you see here, the first letter is F, and that's referencing face. So if you look at the woman's face, there's facial drooping on one side. So if you think somebody is potentially having a stroke, you can ask them to smile, and you'll be able to see if there's any symmetry issues within their face.
Okay.
The second part of the acronym is A, which stands for arm. So you can have the person hold both arms out in front of them, and if there's any drooping in one side or the other, that would be an indication of weakness. Sometimes you may feel some tingling on one side, numbness, but usually that weakness is there on one side or the other. S is for speech. So that may be slurred speech, garbled speech. Sometimes they just can't talk at all. They can't seem to get the word out. from 1 second to the next. So it'll be a pretty rapid change. And T is time. So there is treatments for stroke. However, time is of the essence. There is time constraints on some of these medications and things like that that they can use to treat. So we like to say time is brain. So the other thing I like to remind people about is if they ever wake up in the morning with any of these symptoms, you call 911 immediately, because it may have happened while you were asleep and you don't know how long it's been there.
Okay, good to
But
know.
FAST is the acronym.
All right, well, thank you for that. So, if someone, I guess we could even start with this. What would be some symptoms of a heart attack?
Well, majority of the people, mostly men, that have heart attacks, it's chest pain to jaw to back pain. And if they're doing some activity, they might be short of breath, more than the average short of breath doing the activity, or they might have increased fatigue. Now, the women and diabetics, due to neuropathy and hormone issues, they tend to have just shortness of breath and fatigue rather than the chest pain, jaw pain. So those are the symptoms that majority of the people have for chest pain.
Okay, and then what would be some things they might do should they experience these?
Oh, right away with any symptoms, they should call 911. Within the first 5 minutes, if the heart doesn't receive any blood flow, the heart quivers and gets a little angry, and that's when the heart quivers, no blood flow goes up, people pass out, and that's when they need to be defibrillated.
Wow.
In addition, they have to take aspirin to prevent any clots from forming.
Okay. And also, by the way, Evelyn, with this picture of a woman, is that implying or suggesting that strokes are more common with women?
Strokes are more common with women. However, the symptoms will be the same, male or female. Everybody may not have all of the symptoms. It just depends on what part of the brain is affected by either the blood clot or the hemorrhage. So the symptoms may vary, but they're going to be the same between men and women.
Okay, so for heart attacks and strokes, is this a result solely of personal health issues, or is part of it genetic, hereditary? Is there any of those associations as well?
That's a good question, and we do see many patients in our community program that do present with the healthy lifestyle, the exercise, but due to the genetic issues, they may have a high cholesterol imbalance, and there is a genetic cholesterol. So it does plays a strong role. It just indicates that that person needs to work out a little bit harder than the average person if they have a family history of cardiovascular disease such as stroke or heart attack.
Okay, and is that the same? Well,
Same.
you were just saying, so it is
Yeah.
the same, okay. Okay, good. So we're just about out of time here. Is there a summating message you'd like to convey to the viewers? And also, is there a website that people could go to for more information? I'll leave that up to either one of you.
Yeah, if anybody's interested in getting more information in regards to seeing their risk factors for either stroke or heart attack, you can go to our website and take an online risk assessment. It takes about 7 minutes, and that'll label out your risk factors. And you'll get a report, and it'll explain it all to you. Additionally, we'll invite you to come into our office for further screening and education. All that can be accessed through our website at www.cmhshealth.org/healthaware.
Good. And so this organization is a nonprofit.
Correct.
Okay. And who funds this?
Community Memorial Hospital.
Ah, okay, cool. All right, ladies. Well, we're out of time. I want to thank you kindly for appearing with us today.
Oh, well, thank you. Yeah, thank you for having us.
Thank you.
This is George Alger signing off for this segment of Our Ventura TV. Until we meet again.